Airway management. As a healthcare professional, there are times when you will be called on to manage the airway of a patient who is unable to do so on their own. Airway management is the patient's highest priority. When a patient is unconscious and lying on their back, their tongue may block their airway, causing them to stop breathing. Vomit or other fluid can also block the airway. The 3 techniques for manual airway management we will look at in this video are roll on the side, head tilt chin lift, and jaw thrust. Let's start with rolling the patient on their side. Rolling the patient on their side allows gravity to assist in clearing the patient's airway. For most patients, use the recovery position. If you suspect a head or a spinal injury, use a log roll to put them on their side. When not moving the patient on their side, utilize a head tilt chin lift to manage an airway for an unconscious casualty. This technique is used for an unconscious adult or child casualty who is in the supine position. Place one hand on the patient's forehead and 2 fingers under their chin. Gently push their head back to open the airway. A head tilt chin lift can also be used with an infant patient. To perform a head tilt chin lift on an infant, either place 2 fingers on the forehead and 1 finger under the chin to gently push their head back, or place 2 fingers on the forehead and the thumb from the same hand under the chin and gently push their head back. Lastly, we'll look at airway management for a casualty with a confirmed or suspected spinal injury. In a healthcare setting, hospital, clinic, ambulance, etc., you may suspect your patient has a cervical spinal injury. This is when to use a jaw thrust to manage the airway. Stand or kneel at the patient's head. Place 2 fingers from each hand on the corner of the patient's lower jaw. Place the heels of your hand on the patient's cheeks. Gently pull the patient's jaw upward with your fingers. Only move the jaw, do not move the neck. Your patient's airway is their highest priority. Always choose the best technique for manual airway management for each unique situation. Roll the patient on their side, head tilt chin lift, or jaw thrust.